Yes, I'm Reverend Dr. Q English. I'm the director for the Center for Faith-Based and Neighborhood Partnerships at the United States Department of Health and Human Services. Thank you so much for extending the invitation, Pastor Ed, for me to be here today. My assignment tonight is pretty much just to give you an overview of where we are as a nation. So you're going to hear a lot of stats, but I'm looking forward to digging deeper in our conversation on Saturday. So tonight I'm just going to tackle it from the national perspective of where we are. And when I looked at the title, it was called The Problem. And the problem goes much deeper than these stats and facts I'm going to share with you today. And I'm looking forward to tackling that again on Saturday. So where are we here? So the COVID-19 pandemic was experienced with particular hardship among those with substance use disorders. And Saturday, as I'm going to talk to you from some family history, and again, I'm looking forward to that time together. But overdose deaths accelerated during the COVID-19 pandemic, with CDC estimating that more than 105,000 people died from overdose in the 12 months ending in October 2021, the highest number ever recorded in a 12-month period. An historic high, devastating families and communities. We grieve these losses and commit to continuing our work to save lives. We've also recently learned from a CDC report last week that more than 80% of pregnancy-related deaths were preventable, and that one of the top leading underlying causes of pregnancy-related deaths are mental health conditions, including deaths to suicide, overdose, poisoning related to substance use disorder, at 23%. And we know that too many folks are struggling with substance use disorders. Currently, 40.3 million people aged 12 or older had a past year substance use disorder, according to a survey sponsored by SAMHSA. Meanwhile, more than 4 out of 5 Americans who need treatment for illicit drug use do not receive it. That could be due to the stigma often associated with substance use disorders, lack of information, and/or access issues. And we know mental health and these disorder services have been under-resourced for far too long, and the COVID-19 pandemic has placed an even greater burden on the system. And while the Biden-Harris administration is making major investments to strengthen the workforce infrastructure for mental health, including funds for workforce development, investments in new certified community behavioral health clinics, community mental health centers, and programs like Project Aware that aim to increase awareness of mental health issues among school population, there is still a big and essential role for faith communities here. While treatment for substance use disorders may be essential and available, you all know that the road to recovery is lived out in community where challenges to maintaining sobriety are most often encountered, whether it's access to healthcare services, recovery support groups, employment, or meeting housing and other basic needs. And I'm going to talk more about the role of faith communities later in the conference. I was asked to talk a little bit more about the face of addiction as it relates to substance use. In 2021, more than 100,000 people in the US died from a drug overdose, but we know that nearly 75% of this number, drug overdose deaths in 2020, involved an opioid, including prescription and illicit opioids. Increasingly, the overdose epidemic has grown more complex by the co-involvement of prescription and illicit drugs. Nearly 85% of overdose deaths involved illicitly manufactured fentanyl, heroin, cocaine, or meth, alone or in combination during January to June 2019. Most of you will know from the news about the dangers of fentanyl. Pharmaceutical fentanyl is a synthetic opioid originally developed for the pain management treatment of cancer patients. It is 50 to 100 times more potent than morphine. Sadly, it is being diverted for misuse and abuse in the US, or being illicitly manufactured to be sold. through illegal drug markets for its heroin-like effect. And most recent cases, overdose and death in the US are linked to this illegally made fentanyl. It is often mixed with heroin and or cocaine as a combination product with or without the user's knowledge to increase its euphoric effects. Cocaine is involved in nearly 1 in 5 overdose deaths. It is a highly, as you know, addictive drug that can be snorted, smoked, or dissolved and injected into the vein. And over 5 million Americans reported that they used cocaine in 2020. So the national drug overdose deaths involving cocaine rose steadily from 5,419 in 2014 to 19,447 in 2020. The number of deaths in combination with synthetic opioids has been increasingly steadily since 2014 and is the main driver of cocaine-involved overdose deaths. And then we have heroin, still a major concern. In 2020, heroin-involved overdose death rates decreased nearly 7% from 2019 to 2020. However, more than 13,000 people died from a drug overdose involving heroin in the United States, a rate of more than 4 deaths for every 100,000 Americans. The number of heroin-involved overdose deaths was nearly 7 times higher in 2020 than in 1999. Nearly 20% of all opioid deaths involved heroin, and sadly is what my brother died from in the 80s. And that brings us to psychostimulants. They include illegal drugs such as meth or ecstasy, but they also include prescription stimulants for conditions such as attention deficit hyperactivity disorder, ADHD, or depression. Most of these drugs can be misused and are considered addictive. And nearly 23% of all drug overdose deaths in 2019 involved psychostimulants. 16,000, which was a 28% increase from the previous year. Yes, we do have a problem. And the number continued to rise with drug overdose deaths involving psychostimulants rose from 547 in 1999 to 23,837 in 2020. I'm going to skip down for the essence of time to talk about treatment. But right before I hit treatment, I want to just talk about alcohol. Alcohol remains a nemesis to those struggling with addiction. We had 140,557 Americans die from the effects of alcohol in an average year. So 1 in 10 Americans over the age of 12 have alcohol use disorder. And 60%, over half of Americans, increased their alcohol consumption during COVID-19 lockdowns. 60%, over half of Americans increased their alcohol consumption during COVID-19 lockdowns. So treatment will differ depending on the substance. Medication-assisted treatment, also called MAT, is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of substance use disorders. Research shows that a combination of medication and therapy can successfully treat these disorders. And for some people struggling with addiction, MAT can help sustain recovery. MAT is primarily used for the treatment of addiction to opioids, such as heroin and prescription pain relievers that contain opiates, as well as for alcohol use disorder. The prescribed medication operates to normalize brain chemistry, block the euphoric effect of alcohol and opioids, relieve psychological cravings, and normalize body functions without the negative and euphoric effect of the substance used. However, MAT is not the protocol for treatment for addiction to meth. They say the most effective treatments for meth addiction at this point are behavioral therapies such as cognitive, behavioral, and contingency management interventions. For example, the Matrix model is a 16-week comprehensive behavioral treatment approach that combines behavioral therapy, family education, individual counseling, 12-step support, drug testing, and encouragement for non-drug related activities has been shown to be effective in reducing meth misuse. And lastly, it's important for me just to talk about prevention, both prevention of use and prevention of harm. For me personally, one of the worst statements that I feel that we lived with in our household growing up was whatever goes on in the house stays in the house. And some things needed to come out of the house. And some things still need to come out of the house. In my household, where the cabinet in my kitchen, where there should have been dishes, were pills that my father had to take from the PTSD that he suffered with from being in the service, or watching my brother push a shopping cart down the street with cans and matted hair, or watching my sisters being addicted to cocaine, watching my brother being addicted to cocaine and ODing with heroin and HIV/AIDS. This is immediate family. This is not distant cousins. Why? Because what went on in the house stayed in the house. There was no way to process. Therefore, we internalized what should have been talked about. And so there are a lot, and I am a faith leader as well. Again, I'm going to go deeper on Saturday here. I'm just giving you the national stats, but we do have a problem, and it goes deeper than what I'm talking about today. So the need for getting ahead of the curve and preventing future generations from misusing substances has never been greater. Studies show that the earlier in life a young person starts using alcohol or other drugs, the greater their lifetime risk of misuse or addiction. According to a recently released SAMHSA's 2020 survey, 8.2% of adolescents aged 12 to 17 drank alcohol in the past month, and 13.8% of adolescents aged 12 to 17 used illicit drugs in the past year. Mental health and youth was declared a national emergency last year, 51% uptick in emergency room visits with adolescents aged 12 to 17 attempting suicide. We know there are many factors that contribute to participating in risk-related behavior. Faith and community-based organizations are well-positioned to increase protective factors for children and young adults, promote social norms that protect against violence and adversity, connect youth to caring adults and activities, and intervene to lessen immediate and long-term harms. And we talk about these actions in the center, our center, Practical Toolkit for Preventing Drug Overdose and Supporting Recovery in Faith and Community Settings. Again, this is a high-level overview, and I look forward to going deeper in the conversation at my next session. Thank you.